My object is, it can appear a very mundane object. It's an appointment card for a doctor's. Well, it's an appointment card for a health service for homeless people. But I've been a GP for over 20 years, and well, I've been working with homeless people for that length of time, and I'm a straightforward GP. I work in a GP practice that sees, well, your average person, a mainstream GP practice. But 20 years ago, we were asked to start working with homeless people. And, well, for obvious reasons, really, because we're a GP practice in central Manchester, and there's always been a strong ethic in our general practice that we're here to serve the general community, and that's the people that live around us, and that's particularly pertinent to homeless people. The way the NHS is set up, the way the NHS operates, often puts significant barriers into how homeless people can optimally access the health service. But they, which is ironic, really, because homeless people have the worst health of any population in the UK. So it's a clear statement to try and redress that balance that I felt probably existed. And it's actually 20 years ago now, and it still stayed around, really, as kind of a very symbolic thing. A lot of homeless people don't necessarily feel able to or are in a position to address their health problems, because obviously homelessness is a very complicated situation, and life can be very chaotic, and health doesn't always figure high on that. And I suppose one of the things I always think about with homeless people is it must be terrible, sat on the street, feeling unwell, feeling unhealthy, and thinking, where do I start with that? And I don't think about having a legacy, but if in 20 years' time this card was still hanging around, enabling homeless people to access healthcare, then, well, it's just a very basic thing, really, but it makes me feel quite emotional. I think the thing that troubles me is the complexity, the multi-comorbidities of homeless people. If that's a bit of a technical term, isn't it? But patients have multiple problems now. Much more severe physical health problems happening at an earlier age, much more severe substance misuse problems, more severe mental health problems. And often we find that patients have all of those health problems going on. But what I've learned over the years is that homeless people are extremely anxious about their health, extremely aware of how perhaps some of the lifestyle issues and how homelessness impacts on their health, and extremely worried that something bad is going to happen with their health. And I think, for example, substance misuse has become much more complicated now. I used to see people who had a singular drug problem, and now, I see patients who have multiple, what we would call technically poly-substance problems, which is, using multiple substances, alcohol, multiple types of drugs to a high level, and, which takes a real significant physical toll on people. We're seeing significant poor health. I'm seeing young people with diseases, young people in their 20s and 30s, developing diseases associated with you in your 50s and 60s, really because of the extreme nature of homelessness. The homeless lifestyle that results in extreme substance misuse problems, extreme mental health problems, longer periods on the street, and this has resulted in, much more severe health problems than we've seen for many years, really. I think it's a societal thing. I think that homeless people, in my opinion, my humble opinion, appear to be much more marginalised from society. So I think it's a breakdown in community. It's a breakdown in support networks. I think, which is the general way society is going. Everybody blames austerity, and austerity has a significant part to play, but I think there's been a general shift in society and what are considered to be societal norms. And this has resulted in, well, in some respects, homelessness becoming more acceptable to people. I suppose what I'm trying to do with the card is change people's behaviour. Not just homeless people, but people that work in services like the NHS, to think about entitlement to care, to think about the barriers that exist in healthcare, not just for homeless people, for all people, but certainly for marginalised people. And it's really about how homeless healthcare and the NHS should be a mainstream health priority, just like it does diabetes, cardiology, heart problems, smoking, hip replacements. Homeless healthcare should be up there with getting your hip replaced, getting your heart bypassed, as something the NHS feels it has to provide. No questions asked.